Students in Five Branches University. This is Dr. Chi. Last time holding March 2nd, we have a lunchtime forum meeting with the students in Five Branches. We developed from an epidemic disease to a pandemic disease. So last time when we were talking about this COVID-19 and how China have used the TCM to help the patients in different stage. Back then, there's only 89,000 having COVID-19 in the whole world. Until now, there is 1.6 million people in the whole world are affected by this virus, and then almost 100,000 deaths in the whole world. In US, now the doctors in the front line are worried the standard approach of using ventilators is failing the patients. And this morning, I've read articles in Mercury News that talking about the doctors now. They're even debating does using the ventilator, is that really helping the patient or is hurting the patient? Where exactly is this battlefield and how come the ventilator have failed the patient? So I would like to spend some time to talk about how TCM view this disease now, which is already become pandemic. We talk about the COVID-19, the signs and symptoms. We know there's one thing I really need to emphasize one more time is the fever. Means there's only 43% of the patients presented with fever. So majority of the patient, when they start showing signs and symptoms, but they actually without fever. So only focusing on testing people have fever or not doesn't mean that they don't have COVID-19. I do highly recommend everyone, if possible, can wear a mask to protect the people around you, also protect yourself. If we want to end this fast enough, then we really need to treat everyone as an asymptomatic carrier. In the first week, usually the viral levels are really high, but symptoms such as fever, sore throat, or cough are really mild and moderate. Most of the patients actually have an absence of upper respiratory tract symptoms, so they don't have any runny nose or they don't have any sneezing. Some patients don't even have sore throat. Okay, the immune systems actually can fight the virus and target them, and then people may feel just a little bit fatigued and tired, but they can recover from it. So that was the symptoms that patient have in the first week. But after the second week of illness, even though the virus now at this moment start to taper off, but the immune system goes into danger in the lungs with inflammatory cells. That's why the people enter into ICU. So what happened during these 2 weeks? And then why at the beginning there's not much symptoms and somehow the body can work together, and to still keep the homeostasis. Today, we're going to spend a little time to talk about this phenomenon and how TCM view this. There are 4 classics that all students are required to study. 内经, which is 伤寒论, and also the 金匮要略, which is cover all the miscellaneous diseases which not cause fever. And one more is called warm disease, like 温病学. Is one of the classes that kind of missing in the education in United States. But this epidemic disease falls into the 温病 category. 黄帝内经 is written in about 2,500 years ago. It also talks about the epidemic disease. Emperor said the characteristic of the 5E, or 5 different kinds of epidemics, highly contagious. No matter old or young, they all have similar symptoms. Then Qi Bo is the doctor that working with the emperor. He says, if the upright qi, which is usually interpreted as our immunity, is strong, the body will not be attacked by the evil qi, which present the pathogen. But most of all, Qi Bo says you have to avoid the toxic qi. Upright qi is actually ability to keep homeostasis. We know traditional Chinese medicine, there's no specific herb heal bacteria or virus directly. We're more focusing on keeping our body to return back to the homeostasis. And this also can consider as ability of protecting the body from the external invasion. So what are the external invasion? There's 5 different seasonal changes: the wind, the cold, the heat, the dampness, the dryness are the external invasions that can attack our body's homeostasis and make us not able to deal with the pathogens. And then the toxic qi sometimes is also considered as pathogen, but in 2,500 years ago, Chinese doesn't have a clear view of what is this pathogen is, but mainly they're all thinking about is related to seasonal change. Start from the Shanghanren all the way until Ming Dynasty, which is about 800 years ago. People are all focusing on using Shanghanren strategy to treat all the epidemic diseases. And this is one of the oldest complete clinical textbook in the whole world that discusses about epidemic disease. Zhang Zhongjing talking about the abnormal seasonal changes will cause diseases. For example, now if it's during the winter time, it suddenly becomes so hot that the body is not being able to adjust to the hot weather when they're already prepared themselves for the winter. Or if the weather is suddenly becomes so cold in the summertime, and then they categorize into 6 different stages. It starts from Taiyang, and then enters into Yangming. And then if you enter into the Shaoyang, patients start to have like alternating chills and fever. That means that the pathogen in your upright qi, they are battling back and forth, and neither side will give it in and remain deadlocked. This is the time that we need to help to harmonizing the body. In the history, there's actually 156 times of the epidemic diseases since the Song Dynasty. Well, not until Ming Dynasty, Chinese start to realize there is something more than seasonal changes that can affect our health. There's something invisible that is different from the seasonal that can cause disease that is very highly contagious. No matter you are healthy or not, you will get it. Dr. Wu Youke is the first one establish his hypothesis on there's some kind of invisible enemies that can attack us. So Wu Youke wrote a book called Wen Yi Lun, Treatise on Epidemics. During that period of time, hundreds and thousands of people died due to the epidemic disease. And many doctors of his era were trying to use Shanghanren's formula to treat the epidemic disease. They all failed. So he started to realize there's something different in the air. They call it invisible qi that is different from the seasonal change. They call it Ichi. Okay, Ichi enter into a human body through nose and mouth, and this diseases actually have its own pathogen. Where is this battlefield? He says that it attacks our body's mo yuan. Okay, this is one of the focal points I want to focus this time. What is this mo yuan? Okay, and then if you translate it literally, it means membrane's origin. This Yi Qi attacks our body's mo yuan. He very much emphasized on tongue diagnosis because during the Yi Bing, the tongue changed dramatically. This evil qi or pathogenic qi enters the body through nose and mouth, and it affects the location where it's neither in the organs nor in the viscerals. It did not invade our body through external, where the channels are located, but it enters and lingers in the in-between area, which is called the space of a half interior and half exterior, also called Mo Yuan. And there is another book also talking about Mo Yuan. It says Mo Yuan is a membrane that connects the spleen and stomach, and in the half interior and half exterior area. If you're a Shanghanren background, half interior, half exterior also can consider as a Shaoyang. And also in the channel theory, we can say it's a Sanjiao channel or a gallbladder channel Shaoyang. Shaoyang or Sanjiao area, we can consider the interstitial spaces in our body. This is the place where the pathogen lingers and attacks. This is the battlefield. that we're trying to clear and helping our patient to return back to homeostasis. Where is the 膜原 in the human anatomy? Interior is the organ and viscera. The exterior, that in traditional Chinese medicine, the skin and the muscle, half interior and half exterior. It is actually the interstitial spaces, fluid-filled area that surround the cells of a given tissue. Serous membrane are also composed of two layers. We know that one is covering the organ, the other one is covering the body wall. And in between potential space that filled with lubricating serous fluid that is secreted by these two serous membrane. And we know in our body, one serous membrane of the heart is called pericardium, lung is called pleura, viscera is called peritoneum. What is the function of the serous membrane? It protects and allows the frictionless movement of the heart and lung. We know our heart is constantly beating, our lung is also constantly moving because of the breath. In order to protect them, you need this kind of layer of protection. It also regulates the movement of the fluids and other substances across the membrane. And the most important that I wanted to focus is it actually controlled the immune responses, including the coagulation and also the movement of the white blood cells whenever there is inflammation. So the synthesis of the cytokines and other molecules involved in membrane repair and the inflammatory response. So this is the place where the inflammatory response and the immune responses kicks in. The human immune system reacts to the virus by sending out cytokines to attack the virus. But the problem is that it causes serious inflammation. And many COVID-19 patients enter into critical stage actually is due to this cytokine storm. The virus itself may not kill the host, but the inflammation that causes the fluids and the blood to accumulate in the lung cause the patient to drown. This is the reason why patients get killed by COVID-19. That's why a lot of doctors saying that maybe it's not the virus itself that kills the patient. It's the consequences that are being induced by the virus, the inflammatory response that causes the death of the patient. This serous membrane is the location and the battlefield of this COVID-19 fight. Somehow it's very much connected to what Wu Youke have shown us. This is one of the CT scan for patients who have a COVID-19. You can see the area that's being affected is in the posterior and peripheral of the lung. And there are many patients that presented with chills and fever, and they feel cold in their back. And we know that in the back is where the UB channel are located, which is the 太阳 symptoms in the 伤寒论. So if it's in that level, if you start feel chills and cold in the back, this is the time that warn us that we have to do something about it, to take care of the fluid, not cause them to accumulate too much in the channels that affects the serous membrane. Up until now, you may have a question why the CT scan for COVID-19 patients shows the ground glass opacities in the posterior and peripheral. This paper shows ground glass opacity in the subpleural area. This subpleural areas with all the fluids start accumulating. This is our human lung. 膜原 is very similar to the place where we call pleura. The two layers in between the interior and exterior, where is the places that inflammation responses are start reacting. Yeah, you can see that in the alveoli, okay, is the place that very, very close to the pleura area, and they have a type 2 alveolar cells which have the ACE2 receptors on it. And all the researchers believe the ACE2 receptor is the place where the virus hack into our body. And then once the virus through this ACE2 receptors hacking to our human cells, and it started to replicate and multiply until it used up all the resources and the cell die. The virus starts spreading and then go to the adjacent alveoli. That's the places where this battlefield starts. So how Wu Youke treats 膜原 disease? He says the pathogen doesn't invade the exterior, so you cannot use only the releasing exterior method. Pathogen does not invade the interior, where is the visceral and the organ is, so you cannot use purging methods. Pathogen enters the body through the nose and mouth, and then invades and lingers in the 膜原 area. So Wu Youke established a new method. It's called 分消. 分 means separating. 消 means eliminate or disperse. So means eliminate separately. So he used the herbs that's not only dispersing but also transforming at the same time draining. And he used these three methods all together to disperse, that opens the way for the fluid to come out of the 膜原 area to get released from the external. It also helps the body to transform the dampness inside the organ, and it also helps the body to drain the dampness. So three methods together to accomplish this. So Wu Youke have invented this new formula called 达原饮. Indication of 达原饮 is to treat low fever, chills, chest pain, chest tightness, nausea, headache, red tongue with grassy and powdery white coating. So this grassy and powdery white coating is the indications of the 疫病. Why there's a grassy and powdery white coating is because the interstitial levels get affected by the pathogen. So the fluid in the interstitial level is not being able to move around, start accumulating in the body and presented as dampness. 槟榔, 厚朴, 草果. These herbs are all spicy, warm, and aromatic. We know aromatic herbs transform the dampness, and warm is very crucial in this 膜原 disease, because in the beginning, patients' tongue usually are very pale and then they are very fatigued. So we have to be very cautious to use clear heat herbs too much. And dampness is a yin disease. So we cannot use clear heat herbs too early. That will further damage the patient's yang qi. 槟榔厚朴草果 can directly attacking the 膜原 area. And this is where the places that throw the body into an imbalanced stage. We need to help those fluids that accumulate in the 膜原 area to be dispersed, either through the exterior, also through the bowel movement or urination. Like 槟榔 can promote urination, and 厚朴 actually can transform the dampness through the middle jiao. 草果 also warms and transforms the middle jiao, or the fluid that's being accumulated in the interstitial level. Because it's draining, so that's why they add 知母 to clear heat, but at the same time, moistening. Why you need to clear heat at this time is because once the qi gets stagnated by the fluid, qi accumulates into heat. So eventually the heat will start accumulating. Of course, a lot of the time, the heat is not accumulating at the very beginning stage, but slowly they will build up because of the qi stagnation. That's why a lot of the COVID-19 patients at the beginning, they don't present it with fever. Sometimes they have a low-grade fever for a period of time and then slowly enter into a high fever stage. It's because the dampness and the fluid that's being accumulated in the interstitial level or the half interior, half exterior level that abstract the qi. Once the qi get abstracted, the heat will start slowly accumulated up to the level that breaks into the fever. So once we start treating the patient when they start having fever, then it's already in the progression stage. Huang Qing is clearing the lung heat. It clears heat, drains dampness, especially in the upper jaw. Why here use 赤芍? Because when there's qi stagnation, there's also have blood stasis. And the blood stasis will further cause qi stagnation. So 赤芍 is being used to move the qi. Huang Qing also can stop bleeding. When the blood can move freely, then it won't enter into the acute inflammatory responses that fast. So 赤芍 can actually help to prevent the body to enter into this inflammatory response that will throw the patient into a critical stage. Of course, we can also create our own formulas that replicate the same strategy and using different herbs. 羌活, we can use 独活. If we don't have 麻黄, we can use 防风. We can use 境界. Transforming herbs, we can also use 苍珠. Clearer heat, we can also use 柴胡. The focus for this kind of a 魔源 disease is that we cannot only use the herbs help to eliminate releasing the exterior. We cannot only using the purging method, or we cannot only using the transforming method. We have to use 3 together in order to loosen up the 魔源 area. Is 达元饮 is the best for COVID-19, and it provides a strategy to take care of the patients in the 魔源 stage. We still need to use our pattern differentiation. Wu Youke in his book specifically emphasized there's 3 ones. He says 1 formula for 1 person and in 1 stage. 1 formula only for 1 individual and in 1 particular stage of the diseases. Why checking tongue is so important is because once you start to using this warm, spicy, draining dampness herbs, immediately the qi start to move around. When the qi start to move around, then your upright qi start to having energy to fight back. The patient may enter into some sort of like a heat syndrome fast. Then have to use more heat clearing herbs instead of only using warm herbs. So we have to really take a look at patients and then change the formula accordingly. So I get a lot of questions from the students is to use 莲花清瘟饮 to prevent COVID-19. Look at the 莲花清瘟饮, this formula. We have 莲翘, we have 金银花, we have 板蓝根, we have 贯众, and 鱼腥草, 薄荷, 大黄, 石膏. All these are very cold. This formula is actually very good for patients who have heat syndrome, who have a high fever, a sore throat, dry throat with red tongue or yellow graysy coating. A lot of the doctors in China say that this particular COVID-19, a lot of patients are actually full cold and dampness in the beginning stage. So we have to be very careful by just using this formula as a preventative. So in traditional Chinese medicine, we believe that if we don't have the symptoms, we shouldn't use the herbs. But if you have the symptoms, then of course we can apply the formulas. So if you see patients with heat symptoms, of course we can use 莲花清瘟饮 to help them. Most of the time, there's a lot of things I also wanted to share with all you students, but then we probably need to stop here. And if you have any questions about how to treat, or do you have any patients or friends that already diagnosed with COVID-19 and you have questions, I'll be more than happy to answer your questions. If you leave your information or if you leave your comments, I will go through them and then we can contact you and then we can answer your questions. So I do believe that traditional Chinese medicine can really help patients in the beginning stage and prevent them to enter into a critical stage. Will help patients to recover faster, or if they recovered, it will fall into a stage that really need to reestablish their lung qi. Then we can play a good role in this kind of situation. And then once we know the battlefield is in the 魔源, then we know how to tackle these problems and what will be our strategy. We'll see you in the next video.